weaning, giving them food, which can be quite frightening, even if it can be quite fun for them.
Hello.
Hello and welcome back to the channel. You've joined myself, Dr. James Gill, with Master Gill. At this age, when we're dealing with infants, we have to start weaning, giving them food, which can be quite frightening, even if it can be quite fun for them. Now, if we're using something like Greek yogurt, oh yes, that's gone in nicely. Greek yogurt or anything similar, baby foods as a rule of thumb, is nice and safe. However, if we're going to start giving more structured foods, then we can actually have problems with choking. The question of this video is going to be, A, is it a good idea to work with children on camera? To which the answer is no. But also the question is, how would we deal with a child that was choking? Well, first off, we'd notice a change in the demeanour of the child. So he's alert, he's paying attention, he's smiling at his mummy who's behind the camera, and I've got no worries about him. However, if we became quiet, if there was coughing, there was a change in colour, he appeared to be gagging or having difficulty breathing, ultimately looking distressed, I'm going to be worried that we might be choking. In which case, the question is, how do we as parents intervene? Well, we're going to go through that now. So, if I thought that Felix was choking, we're going to see how this goes. I'm going to get him out as quickly as I can, and I'm going to position him face down over my knee. Apparently he's enjoying this anyway. And I'm going to try and hold his chin, if he would allow. He's not joking, so he's fine. And I'm going to do back blows. I'm striking between the shoulder blades. If that doesn't work, after 5 blows, I'm going to turn him over, again, keeping him now once more, head down, with lots of smiling at mummy. I'm using 2 fingers, and now I'm doing chest thrusts. So the difference between the two is that with the vibrations, with the back blows, I'm using the heel of my hand directly between the shoulder blades, and I'm trying to use vibration to vibrate any source, any sort of obstruction out of the baby. As I say, don't work with children. So just to recap on that, we're doing, in terms of doing the back blows, and that is a crucial word there, I'm using the heel of my hand between the baby's shoulder blades. And there the purpose is to try and use that percussive force to cause vibration to hopefully dislodge the obstruction from the airway. That might be helped by a little bit of air being expelled from the lungs, but that is a secondary point. When we're doing turning the baby over using the chest thrusts with 2 fingers, at this point we are actually using that expulsion of air to try and push any obstruction out of the trachea. Now, there used to be a comment that you could do a sweep to try and remove any obstruction that was in the baby's mouth. We certainly shouldn't be doing that now. The reason being is that in doing so, we could actually push that obstruction deeper into the airway, particularly if the baby has begun to move it just as we're positioning for the choking. So, to reiterate, if our baby is showing signs of choking, we want to get the baby and we want to turn them on our thigh face downward to do 5 back blows with the heel of the hands between the shoulder blades. If that is ineffective at resolving the issue, we're going to turn the baby over, again head down, and we're going to use 2 fingers and we're going to do chest thrusts at the xiphisternum to try and expel the obstruction with air trapped from the lungs. Once you've done 5 back blows and you've done 5 chest thrusts and you haven't had any improvement, that point call 999 or get somebody else ideally to do that, and continue on alternating between 5 back blows and 5 chest thrusts. If the baby was to lose consciousness likely arrest at that point, then move over to doing CPR. So we're trying to pump the baby's blood instead using our hands. We'll have a separate video for you on paediatric resuscitation shortly. The reason why we're swapping over to doing CPR, so trying to do cardiopulmonary resuscitation, is the commonest cause of a paediatric arrest is respiratory issues, likely obstruction. So at which point we want to start focusing on making sure blood is pumping around the body, because even if that blood is still slightly oxygenated, it's going to be better than having that blood sat statically. Hopefully by that time help will have arrived with oxygen. So we've reviewed how we're going to notice that an infant is choking. We've reviewed how to do the back blows and the chest compressions and what to do if those had failed. Hopefully this has been a useful video for yourself. Please put any comments you've got down below, and also if you'd like us to do further videos in this sort of series, sort of paediatric-ish videos, I may or may not have a willing helper for some of these things. With that in mind, take care and we'll see you in the next one. Cheerio. Start weaning, giving them food, which can be quite frightening, even if it can be quite fun for them.